My name is Dr. Lyman Wostrel, and for many years I've thought about being a doctor, but I didn't want to be a doctor because I really hate it when people get sick. It really bothers me. And I was having a conversation with one of my coworkers, and he said, well, I think I want a doctor who doesn't like it when I'm sick. And I just had to stop for a second. I was like, this guy has totally destroyed my excuses. And so I ended up going to med school and graduated. My wife, I met in med school. We joked that we trapped each other. And so we have been practicing together now here in Southwest Missouri for 7 years. And we especially like the DPC model, which is very much in line with my own thinking. I enjoy being able to spend time with my patients. I cannot stand the cattle chute that is insurance-based medicine. I would hope that patients can see that I truly care for them, that the reason I spend time with them is because I want to know them. I would hope that they would say that I'm personable, but that I'm also listening. So when I look at a patient, I'm not just looking to prescribe a medication right away. There's a time. There's a time for medications, but I also am very happy to try to find other ways of solving the problem besides just some pill. There's so many things that can be done and should be done to prevent a lot of the illnesses that people have, and that's why primary care is incredibly important. I want to make sure that what we're doing is not just getting rid of symptoms, but that we find what's truly causing the problem and to fix that. I want to solve that root issue for my patient, and sometimes that will involve lifestyle change. Now, we'll work with anyone, and I understand that some things are harder to change than others. It's easier said than done. But the reason that I want to look for more natural ways of dealing with problems is that I don't want you to have side effects if we can. And one of the things that I truly enjoy working with people on is finding other ways of dealing with psychiatric issues. If I have somebody coming in to talk to me and they're sad because their father just died, last year, it's called being a normal human being. We have to work through it is what we need to do. We don't just make it go away. And our goal is to only use medication in a more adjunctive nature. So that might be like in addition to. I want my patients to feel like they were welcomed. I want them to feel like their issues were heard by me. I want them to feel confident that the plan that we have for them will help whatever it is that they're dealing with. And our goal is to help them not just physically to feel better, but also the other 4 parts of us as a human being. We have a physical body, but we also have a heart from which our emotions are proceeding, a mind from which our thoughts are coming in, our sense of consciousness. We have a spirit, and we have a soul. As a Christian man, I think that the soul and the spirit can cause deep issues if they're not aligned properly. If, for example, we're sitting there with deep unforgiveness and anger over a situation, you can guarantee that your blood pressure is going to start to rise, and you're going to maybe even a depressed effect, or even your energy level being low because of that. Our goal is to try to deal with those issues and to help a person to be healthy throughout heart, mind, soul, body, and spirit.
You have been a big blessing.
Thank you guys so much.
We love you.